Well, hello, Medicare agents. I am Danielle Roberts with Boomer Benefits, and I am also a member of NAHU's Medicare Advisory Group. And I'm here today to talk about updates to the Medicare Plan Finder and Medicare.gov with special guest Justin Lubenow, who is the Executive Vice President at Senior Advisors in New Jersey. Justin, hello, and thanks for being with us.
Thanks, Danielle. I'm looking forward to our chat today.
Yeah, so before we dive into these very exciting Medicare.gov updates, tell us a little bit more about you and the role that you play within the Medicare Advisory Group.
Yeah, so I've been on the Medicare Advisory Group for about 5 years now. And I was, selected as the vice chair of the group about a year and a half ago. And I'm also the CMS liaison. So generally more so on the technical issues and questions, which I think we're going to be discussing mostly today, the connection and channel into CMS for our group. So.
Okay, awesome. Well, I think it's just really cool we talked in the past, some of our conversations about how this is actually a seat at the table. So what is it like to have this kind of channel that NAHU has with CMS where we literally have conversations with them like they're real people?
Yeah, no, it's nice. I mean, I think this all kind of spurned out of when they created the new Medicare Plan Finder back in 2019. A lot of agents were up in arms with the tool when it was released, and there's a lot of issues. And we got plugged in around October of that year during annual enrollment, as if we had the free time to do this, but we did, and we were able to have those conversations. They saw the credibility in our discussions and the issues we were bringing up and how we presented them. As if, really the impact to the beneficiary and built that relationship over time. And we continue to have that channel available. And, if issues do come up, with the Plan Finder at NAHU, we actually have an email box now, the Medicare Plan Finder at nahu.org. And you can send an email there with any issue, and we actually triage it. So we don't report issues directly. We actually make sure that we reproduce them and confirm that they're valid. So we're not sending them a potential non-issue, right? We want to keep that credibility and relationship there. It's been great. Now we actually have, people, like you said, that we can actually email and get responses from at CMS. It's not just a black box to us. It's good to have that relationship. So.
Yeah, that's just incredible because, if you think about it, I think agents at our level out here doing business in the world, we're a little intimidated by CMS, like they're the governing body over everything that we do. And so, of course, that's a good thing, right? Because it keeps everyone in compliance. But also just knowing that there's a meeting where we get to send an email up to you at NAHU, and you go into a meeting with people at CMS, and these emails that are valid and we're bringing a concern or a question or an issue that affects Medicare beneficiaries, and being able to communicate that to CMS makes them seem like not so scary.
Absolutely. And again, it all comes down to how we position the communication. And if we're truly positioning it on the impact to the beneficiary, they want to hear that. Because they want to make things better. That's their number one stakeholder, right? Agents were on their list, probably the middle, not quite the top. But if we present issues that are affecting the 60 plus million people that are on Medicare, they want to improve those systems that they're creating. And so, yeah, it's good to have a human connection there with CMS. So.
Yeah, for sure. And speaking of that human connection, I read an article you put together for the NAHU quarterly newsletter, which was released just this week, about how CMS is actually continuing to tweak the Medicare.gov tools, including the Plan Finder. So can you walk us through some of the minor changes that CMS has deployed for this year in both the MyMedicare.gov and in the Plan Finder?
Sure. So yeah, and I would definitely categorize them as tweaks this year. Nothing really dramatic as far as the user experience. Really, some of the changes went into play in August of this year around the plan details page for each of these Part D plans or Medicare Advantage plans. They're kind of reformatting the information and the data around the drug costs and trying to make it, again, more user-friendly for the beneficiary. The other changes around the pharmacy page and the display of preferred versus standard pharmacies, that information was there before, but they're putting it in a few other places as well to really make it clear to the beneficiary which pharmacies are the preferred versus the standard pharmacies. They continue to tweak the print reports. So when you actually go to a plan details, if you want to save that as a PDF or actually print it out if you're meeting face to face, there's still issues there. We know that there's issues. We know it's 20 plus pages sometimes, and there's a lot of extra spacing, but they're constantly trying to make that better. The challenge they have with that, it's kind of a technical challenge, is it has to do with the fact that they want the display on the screen to look great on a mobile phone, a tablet, and a PC. So there's technical, challenges with that. And then on top of that, making the print format also look great and the spacing work well. It's a complex technical challenge. So they realize it's not perfect. They realize they want to continue to make it better, but that's something they continue to tweak as well. So those are some of the changes to the actual plan finder. When it comes to like mymedicare.gov, the things that they're doing there, they're pulling in more of the data that's in the plan finder, things like your drug list. If you you can actually save your providers now in your My Medicare account, and also your pharmacies now as well. You have your preferred kind of your profile, your medical profile, if you will, and just be able to store that information so you don't have to keep re-entering it every year when you're reviewing these plans and so forth. I think the long-term vision for that data and that profile, they can really get creative with I don't want to, maybe recommending plans, or at least showing, maybe these are some plans where your providers are in network, where the other plans, then maybe they wouldn't be in network. There's a lot, again, there's no defined timeline for that type of functionality, but I think that's kind of the long-term vision. Once they have that profile, they can make it a more personalized experience. So those are the main changes. On the actual Medicare.gov page, they also released it's called Getting Started with Medicare, which is kind of like a guide for someone who's getting started with Medicare. And it walks them through, it's kind of a 4-step process for kind of understanding when to sign up and how to sign up. And then when you do sign up, which the plan to pick, the differences between supplements and advantage plans. And then once you are signed up, how do you use the coverage, and, using the tools like My Medicare. And so this tool is out there, this Getting Started tool. It's something I think as agents, that are in this space should at least be aware of. You should go play, maybe not during AEP, you don't have the free time in first quarter. Just go play around with it and look at the information in there. I spent a little time in there. I think it's a neat idea. Some of the information I think probably needs to be tweaked a little bit, but overall, we just need to be aware of the tools that are out there. So those are the main changes.
Okay, yeah, and that's actually quite a few. And I think, as agents, it's really easy for us out here to go and use the tool and immediately complain, right? That you print it out and it's too long, or a quote on a medication is wrong. And we have to remember that this is a massive website, and they have the feeds coming in from all of these different carriers with prices on drugs changing. And so we need to give them a little slack as well, for sometimes things aren't going to be perfect. And maybe that we can understand that getting a 20-page printout to a 4-page printout is kind of the least of the most important things that they should be working on. And so I'm just excited that they are doing things. And then I actually had a chance to go in and check out that Get Started with Medicare, and I thought they did a pretty good job with it. There was a lot of really useful information in there. So for a first stab at giving beneficiaries a way to get information in an unbiased setting, I thought they did pretty good with it.
Yeah, absolutely. And you mentioned, when agents, we report issues, right? So we have that plan finder box, and you can email in if you find any issues with the plan finder. Candidly, about half of the issues that come in, once we research them and we dig in a little bit, a lot of cases, the agent's just misreading the data.
Yeah.
The information's there. We put in a tablet instead of a capsule or something, and that can affect the pricing. And then there's the other cases where there's truly issues with the plan finder tool. So we should continue to report those. But to your point, the tool itself is a massive undertaking. The amount of data they have to constantly update and keep fresh, whether it's pricing or dosages of all these different drugs, the plans and how they vary by state and by if it's Medicare Advantage by county. I mean, it's a ton of data and a ton of undertaking. I was not happy in 2019. I was very upset, and it affected our business, operationally, and the headache it caused and the impact on beneficiaries. But I think 2 years later, it's a very functional tool. It's not perfect by any means, but it works. So
yeah. Yeah, and I also know one of the other things that I've noticed inside the tool and seeing how it has evolved is that you can use my Medicare.gov now to actually get quotes for Medigap within the plan finder. And so can you walk us through like why that's a problem, and what are some of the concerns that you raised with CMS over beneficiaries searching and getting Medigap quotes within plan finder?
Yeah, so yeah, this was about a year ago. CMS started to integrate with third-party quoting tool for Medigap. It's the one we use. I think it's probably the most popular. CSG is the quoting tool they're integrating with. And basically what they allow a beneficiary to do, they enter in their zip code, their age, their sex, and I believe that's all they're taking in right now. And they basically provide a range of pricing for each Medigap plan based upon that criteria. So for example, plan G based upon this criteria ranges from $100 a month to $600 a month, because there's all other variables, right, on the carrier that you're picking and maybe the underwriting status and so forth. So the current state of the tool is this wide range of pricing. And what they've tried to do, or they're talking about doing, is getting more granular and providing more like the CSG experience, where you get a very specific price for each carrier and each plan that's being provided. And the feedback we gave last year and again this year when they brought this up to us, the good thing, again, we have a seat at the table. We're having these discussions. They're not just deploying this functionality without having a dialogue with us, which is fabulous. And the concerns we brought up, if you provide that level of granularity to a beneficiary with Medigap pricing, there's so many unknowns with how this stuff works when it comes to underwriting requirements, right? And are you in that first 6 months of your Part B effective date where you don't have to worry about underwriting, or are you past that point? Or are you in a state where they don't even have underwriting, like New York, Connecticut? Or are you in a state where they've got a birthday rule? And how do they handle the birthday rule? What does the birthday rule mean? And am I going to qualify for this? And what about household discounts? Some states and carriers have a household discount where you have to be on the same plan as your carrier and Medigap plan as your spouse to get the discount. Other states, you just have to be living with someone who's 18 to get a household discount. Some it's 7%. So the point is, there's all kinds of variables here with the pricing. And if you start providing a granular number, that's a low number, right? A low premium for this Medigap situation, it's going to drive a ton of, I think, phone calls into Social Security, Medicare, and as an agent pool, unnecessary calls to us that we have to then, spend time explaining and discussing when this person may or may not qualify. And it's possible they might qualify, but there's a lot of possibilities that they won't qualify. And it generates a lot of extra confusion, just like the commercials we see out there today. And, a famous former quarterback, driving a lot of extra phone calls that we have to deal with.
Our favorite videos, yeah.
Wasting time. And so anyway, we brought up those concerns with CMS last year. So they did not go more granular last year. This summer, they had the same discussion with us and they wanted to do it again. We brought up the same concerns again. And I'll say, fortunately, to this point, they have not deployed that granularity. Not to say they won't try to figure out how to make that clear and present that to the beneficiary in the future. But for now, it's not out there. And we're happy about that because we can focus on helping people and not, clarifying confusion. So.
Yeah, absolutely. And I just think of like, we've had people in our private Facebook group for Medicare beneficiaries ask questions about these quotes they see. And they're like, how could there be one plan, the rate for plan G, how can it be 100 to 600? Who's charging 600? If you sell the $600 one, do you get a higher commission? I mean, these are normal questions that they're asking, and you have to take a minute to explain that nobody's buying the $600 plan. That book is closed a long time ago. And then it gets this big discussion about how the carriers come out with a subsidiary and they open up another book. And, these are all things that are even more complicated for them. And my concern would be the plan G with a high deductible, where people are going to see a high deductible G and a regular plan G. They're not going to know the difference. They're like, I'm going to sign up for this one that's $60 a month. And then they're starting to pay 20%, which we know they don't like, right? So my dad is on a high deductible plan F. That's what I enrolled him in because he's a veteran. And he didn't even want to spend the $60 on the high deductible. So I had to explain to him about the VA wait times, blah, blah. And finally, Dad, your daughter is a Medicare expert. Just listen, please. I said, you know what, Dad, I'll pay the premium for you. I'm going to just pay this premium and I'll buy this plan for you. And he still asks me about it every year. And even when he's paying the 20%, I have to remind him about the deductible and all this stuff. So we can see with our own clients, even our own parents, that this is confusing information and could cause a lot of missteps by beneficiaries enrolling in something that they don't understand what's going to bring to them.
Yep. Absolutely. Absolutely. And the whole, the fact that the underwriting part of it is just, people can make a decision and go into a high deductible G, not because I'm healthy. I don't have to worry about not realizing that 2 years later, if something happens and they want to get into a regular G or F, or they got to go through that underwriting process. And that's not clear in the tool today. I don't know if they're going to put that in the tool and explain that and they'd have to manage the complexity of the zip code, right? Because that underwriting language is going to need to be different depending on what state you're in. And do they talk about the birthday rules? And so it's, we'll see where it goes. I mean, it's hopefully it doesn't go further than it is right now. I think right now, at least it gives them some information, but it doesn't generate too much confusion. So
some information, and then maybe come up with the questions to ask, which you then can take to a broker who can explain some of those complexities and concepts that just really are hard to communicate online and that need a live person. So I'm interested to hear, I know that you guys are always working on other things behind the scene. Is there anything else going on with what the Medicare Advisory Group is working on with CMS to improve the life of agents? I know that we were instrumental as a lobbying organization in some of the changes that are coming for the Benefits Act. And I wonder sometimes if agents out there realize that NAHU is so involved in that and how behind the scenes we're always working to improve not just things for agents, but beneficiaries as well.
Yeah, no, there's been some, I think, really big wins the last few years from a Medicare perspective, and thanks in large part to our work at NAHU. One was, I guess, about 3 years ago now, where we were able to get the Medicare Advantage open enrollment period reinstated from January 1st to March 31st. So prior to that, they had this Medicare Advantage disenrollment period, which was January 1 to February 14th, where you could only disenroll from an Advantage. You couldn't technically enroll into another Advantage plan. So we were able to get that reinstated. So if people made a mistake or potentially their doctor's not in network anymore, they don't realize it until January, now they can make that one change and get into a different Advantage plan. As agents, we can't market that period, so I want to be clear on that, but it's a nice fallback. If a beneficiary messes up, they can change during that period. So that was a win. Just one of the you said, what are we still working on? Well, as it relates to that win, we're pushing to have the same period open for Part D plans, which would be fabulous. There's no reason why it shouldn't be. If we open that up for Advantage plans, so people can make a fix if they mess something up and they picked the wrong plan or kept the wrong plan, the same thing should apply to Part D. If you find out in January your drug isn't covered because you didn't shop in October through December, which you should review this every year, you don't have a choice. You're stuck, right? You're stuck in that plan until the end of the year. And so we're pushing, that's one of the open items kind of legislatively or regulatory, we're trying to get that added for Part D plans as well. So another win that we were very active in, and you mentioned the Bennies Act, specifically if you're in this space, Medicare, you've experienced this, I'm sure with the 3 months after the 65th birthday, the IEP, where you have this, 2 month or 3 month delay in your effective date. And there's no way around it. You can't use an SEP, when you're coming off of the group insurance, because that 3 months after your 65th, you're going to have this delay in your Part B, which could be very impactful for people. So that part of the Bennies Act that we got into this bill earlier this year, it's not going to take effect till January of 2023, but it's going to happen. Basically, if you enroll in those 3 months after your 65th birthday, you'll get the first of the following month. So you're not going to have that 2 month or 3 month delay. You'll get the first of the next month, which is a huge win for beneficiaries and for the agent. So we don't have to explain that weird rule that exists today for the beneficiary. That's also going to work for the general election period. There's so many election periods with this Medicare stuff. Good thing you put out a separate video explaining all the different elections.
That's right.
But the general election period, for those people that missed their enrollment for Part B and they didn't come off of a group plan, they can only enroll January 1st to March 31st. And today, the effective date is not until July 1st of that year. So there's this huge delay in when they get coverage. the part of the bill we got in earlier this year was to give those folks the following month as well. So if they enroll in
Excellent.
January, they get February 1. If they enroll in February, they get March 1, and March they get April 1. So that's another big win as part of this NAHU group that we were able to get pushed into Washington. So legislatively, those are some of the things we've done, and we're still working on that Part D thing that I mentioned. From a technical perspective, when it comes to the plan finder, I'd say the biggest open item that agents have been still bringing up is the inability to save a beneficiary's drug list without logging into their My Medicare account. The old tool we had, you could use that anonymous number and date and still be able to save that list for future years. Now we have to log in, and not all beneficiaries want us to use their login or create their accounts. So that anonymous save and search, we call it, we're continuing to work on with CMS. They actually had committed about a year ago to get that in for this open enrollment period. However, they got reprioritized at the beginning of this year with the new administration that came in, and that basically got pulled off the table. But we're still having discussions with them and looking at creative solutions, potentially going to give us some sort of access like a ship agent would have to be able to log in anonymously, if you will, to people's information to save their lists. But that's very early stages. I hope to have more information next year on that one. So.
Yeah, that's just awesome. So look at how many different things that we're having an impact on. And so I'm always surprised at when I run into an agent and they are not a member of the organization, because something like, I think I pay $35 a month or so, which is literally peanuts for what we end up getting, which is a voice in Washington who is bringing up things that could be a concern. It's an organization that protects and preserves the future of our jobs, and we've worked so hard to build our businesses. And so it's great that we would support an organization like this. So what would you say to people who want to get involved?
I mean, number one, if you're not a member, join your local chapter. And to Danielle's point, it's a very small investment. You will get that back in ROI. I mean, we can both vouch for it. And I mean, literal dollars and cents. I mean, you're gonna meet people there that are group brokers that don't even deal with Medicare, and they just want someone who handles this stuff, right? And they're gonna want someone to refer to. And if you get one case a year, you're paying off
for your membership.
I mean, it will happen if you get involved, right? You can join and just join and pay the fee, but go to local meetings. You can sign up for one of the ledge chairs or one of the local groups, chair organizations within the local chapter. And they see if you get involved and you want to help people, you're going to find good relationships there and grow your business. From a Medicare perspective, we've been doing these Medicare summits across the country the last, I guess, 4 or 5 years. And those are a great opportunity to get involved and help. I know Danielle is very active in the Texas area with our Medicare summits, and we can use all the help we can get for those Medicare summits. So those are, kind of also Operation Shout. So once you're a member, you get when there's a legislative issue that we're supportive of and we're trying to fix, NAHU drafts these communications that get automatically sent to your local representatives to get these issues addressed. And it's a very simple tool. If you agree with the information, you just basically click on, and you type it, their name's already there, everything's already there. You send the email, and that helps some of this legislation get enacted. So those are some of the areas people can get involved.
Yeah, I sleep better at night just knowing that the dollars and cents that I put in are going to help with all of those things. And I second what you said about getting the return on investment when you join a local chapter. I joined in 2007 or 8, and I remember on my first day sitting there in the luncheon room, and there was probably 150 people in there. And I was watching this group of people at this table up in front, and they were laughing and having a great time and answering questions. And you could just tell, like, the movers and shakers of the industry were there. And I was sitting back in my little chair in the back thinking, I want to be at that table. What can I do to get involved? Those people clearly are plugged in this industry and have connections and contacts. And how can I be part of that? So at the end of the meeting, I just walked up to the chapter president and I said, hey, listen, I'm a brand new member, but I'm willing to pitch in. Do you have any board positions open? And if you didn't know this, the president of the chapter will do the job for any open board position. So if they don't have a person in that, they're the president and they're doing it. And I've learned this many years later when I became president of that chapter. And, you know, he said yes, and he put me into a membership role, which means I immediately got to know all the people in there, almost none of whom were Medicare. It was mostly group and individual brokers. And I made great relationships with those people. And that would have been 2007. And still today in 2021, I get referrals from some of those same brokers. I just had one last week that called in and said she was sending us so many that she wanted a dedicated agent in our office to work with her clients so that the transition would be better. So I don't know how many times over I have paid for this membership, but it is truly, truly valuable. And I would encourage anyone to get involved. If you're in Texas, I would love for you to participate with me in the TEHU Medicare Committee. We're always putting things together. In fact, we have a live Medicare Summit here in Fort Worth coming up on April 26th of next year with yours truly. We'll be doing some CE, and I'll also be teaching some organic marketing strategies. So if you would like to participate in that, please shout at me on LinkedIn or anywhere so that I can plug you into that. And likewise, I think, Justin, I know that you're always helping people to learn about the organization, get involved. So I think the best place for someone to go if they don't know know about their local chapter would just be to go to nahu.org and find that chapter. Would you agree?
Yeah, absolutely. Absolutely. It's been a great experience. I just one more story. I taught a CE class yesterday for a NAHU chapter in New Jersey. And, you know, after the meeting, several people came up, and some people that aren't in the Medicare space that want to get involved. And so we're having discussions there, and others that are already involved but want a local person to work with. We happen to be a general agency as well. The point is the ROI is there. You will get it back, and not just for that. I mean, it's rewarding when you're helping people and working together and networking with good people. So that's my last plug.
Okay, very good. Well, I also think there's a fun aspect to it. I always love the chapter meetings. It's a great way to get CE, but I also love to come to the conferences and just plug in and get to know people, you know, especially if you're a newer agent in this industry. Getting to a conference and sitting next to other agents like us and getting to talk. I mean, before we started this recording today, we asked each other questions for 30 minutes about what's going on in your Medicare AEP, and we're sharing strategies and ideas, and having access to other agents in this industry. That alone is also worth the membership. So I'm selling here on why you should join, but it's really a great organization. We get so much from it. And Justin, we're just, all of us out here in the membership are so grateful for the work that you and Mike do on the legislative aspect with the CMS channel. Thank you so much for that and for participating in this update. So you'll have to come back next year in the fall of 2022 with the updates for the next year.
Absolutely. Absolutely. I appreciate you taking the time to do the video with me. So thanks.
Terrific.
Daniel.
All right. Thank you, folks. Have a great day. Thanks so much.
Take care.